Hey, ladies, it's Professor Marvel. I need about two or 3 minutes. I'll be right back. So it doesn't look like Dr. Kershaw has you guys in the waiting room. You enter. So just hang tight, okay?
All right.
Hi, everyone.
Hello.
Hey, if everybody could turn their cameras on, that'd be great. And then also, if everybody could put their names in the chat, I would appreciate it so I can give Dr. Kershaw her attendance. That'd be great. We thought it was easier for me just to use her Zoom so it wouldn't confuse everybody. So I'm on her Zoom. I'm Professor Marvel. I am Dr. Kershaw's teammate. I'm also the course lead for PNR 208. So it's nice to meet everybody. And could everybody turn their cameras on, please? And put your names in the chat. That'd be great. Just waiting for cameras to get turned on before we get started, please. It's a requirement that cameras are on. It's not my rule. Oh, I should turn on my video. Sorry about that. Hey, there you go. Kiana, I just saw your message. I can't have you driving and attending class. I can't. It's not my rule. It's the university's rule. So if you want to log off and then listen to the first part, jump back on when you're out of the car, and then you can listen to the first part of the recording, that's perfectly fine. Katie, can you turn on your camera, please? And make sure everybody's put their name in the chat, please. How's everybody doing today for a Friday? It's kind of hard having a Friday class, huh? I've got 2 on Friday, and there's actually a review this afternoon. So I've started posting. Katie, can you turn your camera on, please? Otherwise, I have to remove you from the class. I'm not trying to be hard. I'm just trying to follow the rules here. So if you could turn your camera on, that would be great.
It says that I can see you. I'm not sure what's going on.
Oh, so you're
logged
working
in
on it.
Yes,
Okay.
just a moment, please.
All right, that's okay.
I
And then,
just saw it went away.
pardon me?
Oh, I could see Katie for a second and then she disappeared.
Oh, and
But
then,
quick question, I'm sorry.
one second, Sarah. Kiana, if you're still driving, if you could just remove yourself and then get back on when you're not driving anymore, that would be great. Alicia, congratulations. New baby. Kiana, can you hear me? Okay. All right. Katie's working on it. Tabitha, if you could turn your camera on, please, that'd be great. So Tabitha, if you could put your name in the chat, that'd be great. Sydney, you've already been on, right? Your name's in the chat. Sydney, can you hear me?
Oh, yes, ma'am.
Okay. Did you? Okay. Sounds good. Let's see. Pardon me? Okay, Sarah, question, go.
There's a group of us, about half the class. It's from Pensacola. Our next class starts immediately at 2 Central. When you start your exam review, are you going to record your review
Yep.
for us?
I'll review, I'll record it. Yep. And I'll send it out to all the sections. Absolutely.
It'd be a 2-player.
Yep. And then I have another review tomorrow morning. I'm doing 2. Dr. Kershaw, as you know, is out of town for the next 10 or 11 days. So I'm covering for her. So I've started posting in your shell as well. I think she posted all my contact information. Everybody know how to reach me if they need to? That's
No,
yet. No?
I
Okay.
don't.
Okay, it should be in your announcements, but in the chat, let me type my email in here
Okay.
and I'll type my phone number.
I know she told us when she will return, but I don't remember.
Yeah, it's I think I sent you guys a study guide, right? Everybody has a study guide.
Yeah.
Okay, the study guide is an excellent representation, a good starting point for studying for the exam for next week. So there's my email. Okay. And my phone number. If you're going to text me, that's totally fine. Just identify who you are and what class you're from, since I don't have everybody's obviously contact in my phone. Okay, so I'm here to help with troubleshooting for anything you guys need. I believe Dr. Kershaw has set up your exams. I know she has set up your exams so they're ready for download. Well, she sent you an announcement. When are they ready for download? Anybody know?
7:31.
When?
Sunday.
Sunday. Okay. So just make a note of that. Now you guys won't have to download it until Friday. but it needs to be downloaded before you come to class, right? This will be your exam time next week. And I'll be proctoring it for you. So the expectation is that you download download before you come to class. Once you download it once you get it, it's open on Sunday. You probably should just try and download it then, so it's not one thing to think about next week. Okay, and then it just sits in your exam soft queue and it's ready to go for Thursday or Friday. And then since this is your first exam, I would encourage everybody to go into their exam soft and make sure there are no issues. I had several issues earlier in the week with my Monday and Tuesday classes with technical issues. So I would encourage you to go in and check your exam soft account and make sure everything is up and running. Okay.
Can I ask a question?
Yeah, sure.
So I read the rules and stuff for the exam or whatever. The last one, it said, I know that we're not getting our test scores until everybody in community finish, but it also said, but that means that we'll get it that Friday testing day. So are we getting it that same day or what?
I don't think so. It's probably going to be Saturday because
okay.
I have a class. You guys, we have this class today, but I have another PN class tonight. Okay, from 8 to 10. So I was going to send you guys an updated announcement after this class that, hang on, let me just make a note of that. It will probably be Saturday because the course lead for the RN is going to do item analysis with me on Saturday morning. Okay, going through the exam. You guys know what that is, right? Are you guys in term 4 or term 5?
4.
4.
For Cincinnati campus. I don't know about the other.
Yeah, most of you are in term 4. So that's how, obviously we can't, I have an exam tonight. So the earliest I'll be able to get with Dr. Lundy is Saturday morning, but as soon as we get together, I'll go in and post grades, make any adjustments we need to. Okay, so don't email me about getting results early. I can't do it. It's not my rule. It's the university's rule. It's just not fair to start saying, well, you passed, well, you failed, or, your score was a 76 without doing our exam analysis, because there may be points or questions that we throw out and your score is actually higher. Won't be lower, but it'll be higher. So that's why that's why we can't give out anything. Okay, so don't send me an email asking for results. I just can't do it. Okay, any other questions about the exam? Yeah, the study guide is an excellent starting point. It's a combination of your notes that you've been getting for the last 3 weeks. It's a combination of pulling information off from the reading. And while you're studying, remember, you don't just study your notes. You have to go back. I know we say that the notes is a nice summary of the readings and the concept sheets that are in your modules, but you need to read everything. Okay, don't just read your notes in the study guide. You have to go back into your readings and make sure. And there wasn't a whole lot of readings for the first 3 weeks. Most of it was in the modules under your study sheets, which I'll show you where those are. So hopefully you guys can get to one of the live reviews today or tomorrow. I mean, if you can't get there today, hopefully tomorrow. It's factual that and I've seen this now over 2 years worth of terms, if you can attend a live review, you actually do better on the exam than if you either don't attend or don't watch a recording. And certainly if you can't get to a live review, the least you probably need to do is the recording, at least the recording. And you'll only have to watch one recording, because both my exams reviews will be the same, or basically the same. Okay.
And when is the live review? What time?
Well, it's in your announcements. It is today at, is it 3 p.m. Eastern time? Is that right?
Okay. So
Yes.
yes, we have a class during that time,
Okay.
so it's good to record.
Okay, and then tomorrow morning, I'm doing one at 9 a.m. Eastern time.
We have clinicals tomorrow about, I was probably say at least 12 of us or 8 of us.
Okay,
So we'll have to
right.
get-
So you guys will need to watch the recording and I'll post that for you. I'll post the one from today, this afternoon, after I get it. Okay, make sure everybody's put your name in the chat. Taisha and Dakisha, I need your cameras on, please. Taisha, are you there?
Yes, I'm here.
Could you turn your camera on, please?
Yes.
Thank you. Let's see, as far as other housekeeping items, I will do a recording over the weekend for week 4 material, since we'll be taking exams next week. So you'll get a recording from me with regards to week 4, and I'll just send that out to all the sections. I don't know that Dr. Kershaw did a recording for week 4. So I will do that. That way we don't have to cover weeks 4 and 5 in week 5. Okay. How are you guys feeling about the class so far? Have you enjoyed the first couple of weeks? Have you learned a lot, or?
I'm not even gonna hold you. This class seems impossible to understand, but I'm sticking it out.
Why does it seem impossible to understand, Kevin?
I don't understand it either.
I just don't get, I mean, I get the whole, okay, you teaching the whole community of people. I get that. And I feel like us being nurses in general is showing examples of that, but I just
Mhm.
really don't see how this is a whole course, honestly.
That this is a what course?
A whole course. Like, I don't see how this is a whole class. I'm not understanding the material that much.
Okay. Have you reached out to Dr. Kershaw about this?
Not her per se. I'll be honest about that, but I have reached out to some of my faculty members at my school
Okay.
and students in my class as well. I mean, I'm like I said, I'm just striding on along. I did pretty well on my first 2 quizzes, so I just need to quit
Okay.
psyching myself out. But yeah,
Well, maybe not be so hard on yourself. What did your faculty at the campus say when you reached out to them?
pretty much the same thing that Miss Kershaw is saying about like how you have to not think about one person, think about a whole community of people.
Mhm.
Even our peace teacher yesterday or the day before yesterday was like giving us different examples of community nursing, because when she went to school, she was taught as a community nurse. Like that was
Mhm.
their concept at her
Right.
nursing school. So
Right.
she understands it. I just have to get it.
Okay. So Kevin, are you going to plan on trying to attend one of the review sessions?
Yes, tomorrow, because I have a
Great.
class at 3 today. So
Okay.
tomorrow I am.
Okay, great, great. So what have you guys learned about community nursing in the last couple of weeks? Take your clinical hospital hat off. What have you learned about community nursing? What's the role of the nurse in community nursing, and what kinds of hats might you wear as a community
Pretty,
nurse?
pretty much from my understanding, I think that community nursing is basically just promoting health overall. Like you're trying to prevent like worldwide
Mhm.
diseases and things from happening.
Mhm.
And yeah, like you just do things, you have interventions that prevents and
Mhm.
promote the health overall.
Yeah, yeah. And have you guys grasped yet the difference between community-oriented nursing and community-based nursing? That's at the top of your study guide, and you will need to know that for the exam. So what's the difference? You should have reviewed that in week 1 or week 1 material. What's the difference? Community-oriented, community-based? I have a pretty,
Oriented, oh, I'm sorry.
no, go
Oriented
ahead.
is the large population, and
Yep.
community based is like the one person in their family or like their household.
Yep. So here's the way I think about it, Kevin. I think about community oriented is the big picture. you're trying to orient yourself to the community as a whole. So you're orienting yourself to health risks, health promotion. What does the community as a whole need? Okay. And then I think of community-based is you're based in the community. You're taking care of the ill population. Does that make sense? So if you think of those two words, oriented and based. Oriented is big picture. Based is focused, right? You're taking care of ill individuals, families, right? And remember, with community nursing, your client might be an individual, your client might be a family, or your client might be a subset of the population, say the homeless or the diabetics or the elderly or the disabled or the substance abuse. Okay. It may be a separate vulnerable population within your community. So I need Tiash, I need all of you new guys that just came on, Dakisha, Taisha, Devon, and Brittany. I need you guys to all turn your cameras on, and I need for you to put your names in the chat, please.
I have my camera on.
Oh, no
I've
worries.
been here.
I'm just
I've
reminding
been
you
here.
to turn them on.
My
It's on.
camera has been on. You were in my pocket.
Oh, I was in your pocket. Okay.
Yes, I've been here.
Okay.
I was here on time.
Yeah, no worries. No worries. So that's the one way to remember about community nursing. Okay, you got to take your clinical hat out. You got to take your clinical inpatient hospital hat off for this class when you come to this class. Okay, because yes, we're still using ADPI. Everybody knows what ADPI is, right?
Mhm.
Right. So we have to be able to, it's a nursing process. So the nursing process, your ADPI also applies in community. So we have to be able to take our nursing process and tie it into the community or translate it into the community. So what is an assessment? What does an assessment look like in the hospital versus an assessment look like in the community? Okay, what does planning look like for a single patient in the hospital? And what does planning look like if your client in the community is a family? Right? Or a subset of the population. Does that make sense? So you really have to try and separate your ADPI and how does ADPI work in the community? And remember, with community, you're bringing your whole toolbox, right? You're not just working on a pediatric unit or L&D unit. You could be working with any kind of situation across the whole lifespan, right? In the community, you could be working with infants. You could be working with toddlers, kids, adolescents, high schoolers. You could be working with adults, female, male, elderly, disabled. So all your tools are coming together, right? Your med surge, your fundamentals, your, what else have you had so far? Maternity, right? So community is kind of a much bigger scope, obviously. So Kevin, does that help a little bit?
Yes.
Okay. I mean, I tell my classes at the beginning of the term that I know you guys are busy. I know you guys are busy taking other classes. I get it. I get it. This isn't a hard class. Okay. There's not a lot of work to be done in this class. The number of hours required goes along with the credits. Okay. That's all been developed by the curriculum team. This is not a hard class. This is not a class you want to repeat. Okay, if you can just block out some time during the week to get your community assignments done, and then you're done. Go do your readings, go do a quiz, whatever. It's not a hard class. I tell my groups at the beginning of the term to just sit back and enjoy this class, right? It's different. It's different from your other classes. There's no clinicals, there's no sims. And just learn about what community nursing is, because whatever nursing you decide to go into, you're going to be dealing with community nurses. If you work in a hospital, you're going to be working with community nurses as far as discharge planning or transition to long-term care facilities or assisted livings or even transitioning home. Hey, you are going to be exposed to community nursing in one way or the other. Even though you might not work in community nursing, you might be part of a team from the hospital setting or the long-term care facility that is having to communicate with a community nurse team. Right? So just sit back and enjoy this class and learn about all the different aspects of community nursing. It's a different class. So that's what I tell my group at the beginning. It's not that hard of a class. I actually think it's quite interesting. And wherever you decide to work in nursing, you are going to have to know something about community nursing. So does that help? Okay. I'm going to share my screen here. Go over a couple of things. So you all have your HESI prep assignment, right? Everybody has that. Dr. Kershaw sent that out in the first couple of weeks. Yes or no?
No, I never seen
I've
that.
never seen that.
I
Guys
don't have it.
Okay, all right. I'm going to send it to you guys after class. Okay, so this is a community, this is actually due in like week 10 for some points towards, it's part of the homework grade. So it's the other 20%, right? So this is a HESI prep assignment. Okay, so we have gone through previous HESIs for PNR, and these are the topics that come up. Okay, so at some point during these weeks, before you take the HESI, all of this should be covered in class. Okay, so I go through with my groups every week and say, okay, what boxes can we fill in this week? Right? So this is a study guide. This is what this is considered, a study guide. So when it comes time for HESI, you know, and I give you this list of topics, you're not going, oh, what week did we cover that in? You know, even if your notes now are week three, chapter 11, that may be all you have time to put in there for now, right? But at least you know where to go back and find the information. I tell my groups to try and fill it out within a couple of days after class, or at least highlight what we've covered. You know, we've done a lot of this already. Okay, we're going to cover some more of it today. So that's what that is. So I'll send you guys the HESI prep. All right, I'll send you guys that. And we're only in week 3. So maybe go back for the first 3 weeks and highlight or fill in the boxes of what we covered. All right, so that's one. And then we'll go through our notes. That's what we're going to review this week. I think going forward, I'm going to try and work on it before your next class. With the updated curriculum, Elsevier has a whole instructor resource for me. And so I may transition the notes over to the PowerPoints, which reflect your reading. So it won't be anything, it will just be in a different format. Okay. Notes are fine for the first 3 weeks, but I'd like to get things going for week 4. I also like for you to have your study guides at the beginning of or sometime during the first week that it's going to cover, but I didn't get the study guide done until a couple of days ago, so I apologize for that. But hopefully sometime during week 4, I have your second exam study guide, which covers weeks 4, 5, and 6. That way you can kind of follow along the same way as you follow along with the HESI prep that I'm going to send you guys. And so then what I like to do is review oh, shoot. I just lost that. Let's see. Bear with me. I can't minimize my screen to go back and get that. So let's see if it comes up in my downloads. Shoot. I have to think, I have to go back and grab those notes, but I cannot. Let's see. I know where I can find them. Where's my notes? There they are. Okay. Okay, found them. The other thing I'd like to cover is your module. Okay, so we're in week 3. Okay. Do you guys know what we're covering today? Has anybody reviewed their week 3 module? This is what we're covering today. Okay, migrant farm workers, rural populations, and homeless and poverty. Okay, and then your student activities for this week, obviously the readings. Continue to work on your HESI prep assignment, which you guys will start to do because you don't have it. Prepare for unit exam 1, which is hopefully attend a review session. And your assignments for this week were NCLEX. Just a couple of things about NCLEX. You've got to access your NCLEX assignment through the module link. You can't go into like evolve.com, elsevier.com. You have to access it through the link. Otherwise, you're going to end up sending me a screenshot, which we can't accept. Okay, everybody knows we can't accept screenshots, right? You guys are in term 4. You guys know that, right? So you have to go through your module link. I've already sent out a couple of emails. Students have already submitted their NCLEX and it's a screenshot, and I've sent the messages back, but I haven't had any resubmissions yet. Okay.
How do we submit the NCLEX?
Right through your module. Your link right through your module. Have you done NCLEX questions before?
Yes, and they didn't have any problems with that. So
Yeah.
we download it and send it?
Yep.
Or are you talking about they sent
No,
screenshots through
I'm
email or something?
I'm talking about just accessing it through your module, not outside your module.
You're saying send it in the PDF form.
Yeah. My main point was accessing.
Okay.
My main point was accessing it through your module, because the few people that have sent me screenshots have not accessed it through their module, and therefore it's kind of a headache
Okay.
now. So
I was just confused. Then.
yeah,
I'm
I'm sorry. Make sure you're requesting a batch of 50 questions, okay? And you guys know where to find the topics, right? They're right in your module on your NCLEX page, right? Make sure you're requesting a batch of 50. Don't do 225s or 510s, because you're not going to get the benefit of all those categories being added in. Okay. I don't know what Dr. Kershaw does, but if I have a student that submits below a 40 for their NCLEX, they're in the 30s, I'm going to put the 30s in the grade book, but I'm also going to send a message back that if you would like to redo it, I've reopened the assignment and you can redo it for learning purposes. Because remember, when you do your NCLEX, you can do your NCLEX as many times as you want, right? And you submit your highest score. But what happens when you do your NCLEX and you, let's say, don't do well? Remember, they send you back the rationales, right, of why you got it wrong or why the answers are correct and why they're incorrect. That's the purpose of learning through NCLEX. And I always say that if you have access to rationales like you do in NCLEX, please take advantage of them. So if you submit a 30, then you probably haven't learned a lot from that NCLEX assignment. And that's why I'll send an email and say, I've reopened it for you in case you want to redo it for number 1, a higher grade, and number 2, to review the rationales. That's where the learning comes from. Does that make sense? You can do it as many times as you want. I mean, obviously, it's best to submit close to a 50, because that means you got all the questions right, and the ones you got wrong, you redid. And so, but that's just a suggestion. Okay. And now you have, this week, we also have quiz 2. So I saw some of you have already done quiz 2 before lecture that's fine. But the quizzes are meant to cover this week's material and then you take it after, but that's fine. And then I like to do the attestation at the end of the class so that we all get it done and submit it. And it's one less thing you guys have to think about. Okay. Up here, assignments, begin vulnerable populations project. So did Dr. Kershaw review that with you yet? Okay, so I'm just going to review that with you. So down in week, where are we? Week 3.
Excuse me.
Yep.
Are we gonna do a lecture today?
Yeah, we are.
Okay.
Yep, we are. These are things we need to cover. Okay. So begin working on vulnerable populations assignment. Has anybody taken the time to go through and look at what your vulnerable populations assignment is all about in week 10? And this is it. Okay, so this is an assignment that you can start taking. It says in the module to review vulnerable populations assignment. This is an assignment you can't start on week 9. So I'm just pointing this out to you. So why don't you guys review that on your own? Okay. There's no reading assigned for this week in the books, but what the reading is assigned to is your sheets in the module. Has anybody had a chance to review this yet? You have 4 sheets. You have your migrant farm workers. This is your reading for the week. Rural populations. Your homelessness. That's what we're going to cover now. And your poverty. Has anybody had a chance to read any of these? Anyone?
No.
No. Okay. All right, so we're going to cover these sheets and we're going to connect them with the notes. Okay. Anybody, any questions before we get started? Okay. Migrant farm workers. Okay. So everything I review with you today will be new information since nobody's reviewed it ahead of time. So migrant farm workers, what do we know about what do you know about migrant farm workers? What do you know? Who are they and what are their roles?
That they're like prone to like tuberculosis.
Okay. Okay. What else do we know about migrant farm workers? Can they be seasonal?
They move around a lot.
Yep, they're seasonal. Okay, there's an estimated 1 to 3 million farm worker or migrant farm workers / seasonal employees.
A lot
Estimate.
of them are uninsured or
Mhm.
don't have really good insurance.
Mm-hmm. That's true. Yep. Okay, so here's some statistics about migrant farm workers. Approximately 16% are migrant workers and 84% are seasonal workers. And this is right here in your notes, right? Primarily, populations are Hispanic. Okay, that were born in Mexico. Other populations include white, African American, Haitian, and Asian. 68% of farm workers are male. And I find this to be really interesting. The average age is 38 years old. Okay. So what do we think some of the common health concerns are for migrant workers and their families? Some have their families with them, some don't. What do we think before looking at this? What do you guys think some of the common health concerns would be for this population?
Definitely the chemicals.
Mm-hmm. Pesticide exposure, that's really big. Mm-hmm. Also heat-related illnesses, right? Working in the sun all day. Exposure to pesticides and other chemicals, injuries from equipment, tools, urinary tract infections, right? Maybe lack of toilet facilities, animal bites, and then certainly a higher susceptibility to infectious disease. Why?
And not being vaccinated.
Okay. What's another reason?
Some of their living conditions.
Exactly. Right. And then the third is their accessibility to healthcare. Okay. We can touch on that now. Why do they, their lack of access to healthcare? Number one, you said they don't have insurance. Number two, that's correct. Number two, these jobs don't come with health insurance. And so if they're living in poverty, they don't have the money to go seek out health insurance. Okay. And number three, if they're undocumented, which 49% of them are, then they may be hesitant to seek health care for fear of immigration and deportation. Okay. And then some other common health concerns are mental health issues, specifically depression. Okay. It's just the cumulative effect of moving around and trying to take care of your family, living in poverty, stress levels. Okay. And these are all right in your module. So barriers, what are some of the barriers? Right? We started talking about these just a minute ago, of this population from receiving healthcare. So cost, shortage of services. What happens in these rural, these areas where migrant farm workers work? Are they rural or are they urban?
A lot of it is rural areas.
Right. And what issues do we have that go on in rural? Lack of healthcare services, right? Lack of specialists, vacant positions, right? There are maybe cultural issues, language barriers, right? And if there is language issues, they may not even understand what you're telling them about healthcare options. Okay. And then because these jobs don't come with, paid vacation and sick days and retirement, right? They're hesitant to take a day off, because what happens if you take a day off to go seek health services? What happens?
You don't make any money for the day.
You don't make any money. All right. And then, of course, these are very isolated jobs, working out in a farm. Okay. So social isolation. And then we talked about this last one for undocumented workers, fear of immigration. All right. So we know that the frequent relocation, especially with the seasonal workers, creates a challenge to the community, to the continuity of care of these clients. Right? They don't have close monitoring of chronic diseases such as diabetes, cancer, HIV, right? So a lot of times if they're not seeking out preventative care, which they're not, by the time something is diagnosed, it may be advanced, which creates a lot of other problems. Okay, because of their inaccessibility, right? Because they just don't seek preventative care. Okay, so a lot of good resources on this page as well. Okay, so let's jump over to the notes and cover migrant, and let's see what we didn't cover. All right, from your education page in your module. All right, they actually, you know what, before we do that, I'm going to go back, because in your notes, it's your rural and migrant health are listed together. So let's cover migrant health, and then we'll go back and review the notes. Okay. Or excuse me, rural health. Okay. Rural populations. What do we know? There's a lot of similarities between rural population health risks and migrant farmer seasonal worker health risks, but there's also some differences. Okay. We know that access is a huge issue as well. Okay. We know that everyone, whether you live in urban, metro, whether you live in every state, we know that everybody should, they don't, but they should be able to access conveniently and confidently access services, especially primary care, dental care, behavioral health, emergency care. I mean, that's one of the healthy people goals is access for everybody. Okay, why? And this is just in general, right? To improve your overall physical, social, and mental health, disease prevention, early detection, diagnosis and treatment, quality of life, trying to avoid preventable deaths and life expectancy. If we all had access to these services, would be in a lot better shape, but we don't. And the rural population doesn't have a lot of this either. Okay, rural residents often encounter barriers to healthcare, and a lot of this will sound familiar to the farm workers as well. Limit their ability to obtain the care they need, right? They don't have sufficient access, and especially specialty access. Let's say you have a pregnant mom and she's high risk OB. There's not high risk OB in the rural areas. I mean, there may be, say, a primary care physician who may have some experience, but you're going down to the next largest city, right? Same with pediatrics, same with geriatrics. If you have specific issues, a lot of times you don't have access to that in the rural areas. All right. And then you talk about transportation. Transportation is a big issue in the rural areas. Lack of transportation. How do you get down to these cities? Can you take a day off from work? Okay. So again, these next 5 bullets are similar to migrant. Fight the poverty level. Do you have the ability to pay for health or dental insurance if your job doesn't provide it? A lot of low-paying jobs do not provide insurance in the rural area, in addition to the farmers, right? The next bullet is about language barrier, right? What if you're not fluent in English? Poor health literacy. How are you going to understand how do you even communicate your health issues? And this is a big difference in rural communities from migrant farm workers. Trust that they can use services without compromising privacy. What do you think that means? Trust they can use services without compromising privacy. Go ahead.
Is it because they live in a small town?
Keep going.
So like basically, like small town, everybody knows each other's business or whatever. So if I go to the doctor and I have this going on, you might go and tell the neighbor because it's like 8 of us that live in a small town.
Yep, that's exactly right. Kevin, I think you're understanding this more than you think you are. Yes, that's exactly right. One of the issues, they call it anonymity, the lack of anonymity in the rural communities. A lot of people don't come forward for early services, right? Or let's say violence is very prevalent in the rural communities. Abuse is very prevalent, domestic violence, sexual abuse. People don't come forward with those until it's bad enough that they end up in your ER. Okay, so the lack of anonymity, they just don't trust that everybody and their brother is going to know about what's going on. Okay. So we talked about barriers, transportation, literacy, and then also there's a stigma associated with rural communities, right? The stigma of mental health issues, substance abuse issues. Okay. I talked about this. Rural populations have more limited access to primary care docs than residents in the urban areas. They're older, they're sicker, and they're definitely poorer than their metro urban counterparts, right? It's hard to get home health. It's hard to get hospice services to these clients in the rural community. It's costly. People have to drive there. Okay. Specialists, they'll bring them down into the metro area for specialty care. All right, so you can read the rest of this, but what are the barriers? We discussed this. It's in more detail here: distance and transportation, and then workforce shortages. Look at this visual. Okay, workforce shortages drastically impact rural communities. Okay, this is a visual, look in the purple. Healthcare professional shortage areas for primary care. The purple is the rural communities. That's a lot of limited access. Okay, it's hard. It's hard to recruit for healthcare professionals to work in the rural communities. Okay. Health insurance coverage, we talked about that. Broadband access, internet access. You know, it may be limited in some of the rural communities. Big challenge. Okay. Poor health literacy, we just talked about that. Social stigmas. Okay, and then it goes through why primary care access is important for residents. We've covered it. Early detection. Okay, especially for pregnant moms, you know, prenatal care is critical to prevent your low birth weight infants that are low birth weight, higher mortality, morbidity in the rural communities with pregnancies and babies. And then improved behaviors. A lot of the chronic, one of the biggest costs to the healthcare system right now is chronic conditions. Okay, people are living longer, there's more technology, there's more medication. Okay, so, and take that one step further with rural communities. Since they don't seek preventative care, you're typically diagnosing them in the later stages of their whatever condition, diseases. Okay, and so because they're not seeking primary care, we don't really have the ability to do our primary prevention activities, right? Teaching, education, you know, about heart disease and obesity and we get them in the ER when they're grossly obese and they've been diagnosed with type 1 diabetes. They just don't do a lot of preventative care. Okay, what types of health services are frequently difficult to access in the rural areas? We talked about this and read through it. Home health, hospice, mental health services. I have a quick example. I spend a lot of time during the year way up in Northwest Wisconsin, which is a rural area. About a month ago, 5 weeks ago, I had to go get fingerprints because I needed to obtain my Pennsylvania license because one of my classes has Pennsylvania students, and Pennsylvania is not part of the compact, right? Where you can practice in all the other states. Anyway, I had to go to the local police station in this rural, very rural community. And so as the officers were doing my fingerprints, I was asking them, I said, you know, I teach community health, public health. What are your biggest issues up here in rural? And anyway, the very first thing they said was mental health. Mental health was their biggest issue that they deal with. And the second one was abuse, violence. So they just kind of validated what we teach. And there's very limited mental health services in the rural communities. Look at this graphic. All the purple is shortages, areas that have shortages for mental health. That's a lot of areas that don't have mental health services. And what have we seen over the last couple of years with the pandemic? Has the need for mental health services increased? A lot. And rural areas were not immune to COVID. So lots of challenges. Okay, and then you can read through why OB and maternal health services are critical to be on top of in the rural communities. What's the plan? What's the plan if you have a complicated pregnancy? Okay. Oral health services is another issue. Okay, we know that oral health affects your overall physical and emotional health. Oral health services are very limited in the rural communities. Okay, and then there's a section on how do the rural healthcare facilities and service closures impact access to care, makes it even more difficult. So there's a lot of organizations and a lot of groups that are working with rural communities to improve access. They're not just kind of hanging out there on their own with nothing to do. There's a lot, and this goes through it. There's a lot of resources that are working to tie the rural communities with the metro areas. Okay, so that's what that's about. Okay, so what are some strategies to improve access to care? There's some different delivery models that are being worked on. I want you to read through these. You need to know these delivery models for your exam. Okay, so you don't need to know everything about them, but maybe just know what kinds of delivery models there are out there. Okay, and there's a few of them. Okay, and as we just talked about, lots of organizations are working on affiliations with the rural to the larger systems. I know the hospital, the little teeny hospital that's up where I am, is affiliated with a big facility in Eau Claire. Okay, so there's a plan. There's a plan. If somebody comes into the little teeny hospital and they need to go to Eau Claire, they're not scrambling. There's a plan for transportation. There's a plan for a bed. There's a plan for housing family. Make sense? So these are all in the works, okay? But rural living presents challenges for health if you're not healthy. Okay, and then efforts to improve the workforce. How do we recruit to work in the rural area? Telehealth. Who hasn't done a telehealth call in the last 2 years? I have. Has anybody else not done one or done them? I mean, that's what we've been doing with the pandemic. A lot of telehealth. Okay, and then veterans. Veterans, you know, the big VA centers are not located in rural areas. They got to travel. This is a good article here. Access to rural care among veterans, if you want to read more about it. Okay, and then a section about other vulnerable populations in the rural areas, your American Indians, your Alaska Natives, your Native Hawaiians. Okay, and here's what I was talking about. Lots of organizations are working to improve rural health access. Okay, and there's a list of them. Okay, so let's go to notes and see what we didn't cover. Okay, so these are together, lumped together because there's so many similarities. Rural means you could be living on a farm, you could be living in a village, a small town. Okay, and definitely in the last decade, there has been a population shift from urban to rural. Why do you think that is? Maybe
Save
cost?
money.
What?
Yeah, I said save money.
Yep, yep. The other thing that's really prevalent in the rural community is poverty. Okay, poverty is pretty prevalent, and this comes up in here. Okay, so here's some more statistics of the vulnerability. Obviously, rural areas are much more vulnerable than the metro areas, right? The age, the highest proportions are younger than 18 and over 65. They have fewer years of education, and you have both of these documents. You have your module with the pages, and you have these week 3 notes. Residents have less formal education. Okay, and amazingly, more than a quarter of rural people, rural families live in poverty, which means a lot of kids live in poverty. Okay, and the biggest group that's at risk in the rural population is the kids. Typically more prevalent in the racial and ethnic minorities and in the single parent families in which a mom or a woman is head of the household. We already talked about fewer residents have insurance. Okay, we talked about them not prioritizing their healthcare, not engaging in preventative activities, right? Even if it's their behavioral activities, so more likely to smoke, have higher rates of alcohol use. They don't really do screenings for, say, pap smears or blood pressure checks or mammograms, right? So we talked about this, they're much more likely to have chronic diseases at the advanced stages. The examples we provide here are heart disease, COPD, cancer. And amazingly, nearly 50% of all rural adults have been diagnosed with at least one of the chronic conditions, as opposed to 25% of your metro area. That's amazing.
Can I
Okay.
ask a question?
Yeah, of course, Kevin, go ahead.
Okay, so I already took the quiz because I was confused on what kind of content, I mean, which week content to be on. But my question is about, since it's saying that like they're less likely to engage in screenings and stuff like that, what will be a preventive measure for rural like people? Like, what would me as a nurse, what type of screening would I do if they're not into doing that? Am I convincing them to do this, or?
So, primary prevention is trying to prevent something before it happens. Okay, so you would be educating them on the importance of primary care visits, on the importance of how do you stay healthy? What's good nutrition? The importance of getting screenings. You would try that first, right? That's what we want to do, is primary interventions, prevention. They're not into primary interventions, then you move into secondary, which is your screening, and education goes along with that. So what you're doing in secondary is you're trying to early identification, early intervention. So if you're in secondary, you're trying to identify those at risk. If they don't want anything to do with primary, fine. But what you can then do is identify the more at-risk population for, say, obesity. Okay, and then you can try and educate them on how important it is to get a screening. Or if they have a family history of cancer. In the secondary prevention would be educating them on how important it is to get a pap smear and a mammogram. Does that make sense? Okay, good. Okay, what else do we want to cover? Only 10% of US docs work in rural areas, where 25% of the 25% of the population lives in the metro areas. Okay, why do rural clients get sick? Because they don't maintain their independence, because let's say the distance between driving even to a clinic, forget the hospital, but even driving to a primary care appointment, lack of transportation, lack of services. We talked about that. We talked about this, have rural higher infant morbidity and mortality rates, right? Especially in areas that have a lack of workforce. Okay. Then we talked about mental health, much higher rate of persistent depression, much more at risk for stress-related conditions, especially when you add poverty into that. Okay, I've highlighted a few things here. Rural areas have 4 primary high-risk industries. We need to know this. Okay, there's 4 industries that are at much higher risk: forestry, mining, marine-related fields, and agriculture. And then back to farm workers. They have several risks, which is in here, but I've highlighted the most significant risk. Why do farm workers have a significant risk to pesticide exposure? What are they doing with the farms? Spraying farms for, right? With chemicals. Okay, and then kids living out in the farms have the similar health risks. And this is highlighted, so I want you to know this. What does acute pesticide exposure look like? Because if you're working in the rural community, you better be able to identify somebody who's been exposed and what they're going through. So I've highlighted this for you. This also goes for rural, migrant farm workers and rural population, female. Higher risk of sexual harassment and sexual abuse. That's a given. Okay, farm workers, when they arrive to the farm, may be given housing that's substandard. And that puts them at risk for a whole bunch of more things. What are they at risk for as an infectious disease when they're all living in close quarters?
TB.
Yep. Yeah, and then put the kids in those positions. Okay. So any questions on rural and migrant health? We're going to cover poverty and homelessness now. Anybody have any questions on that? Where's Kevin? Kevin, do you have a better understanding of that? Was that explained? Pardon me?
I said I do.
Okay, good. Okay, let's go back to, I mean, these are hard subjects. Migrant care, rural care, and these next two are even harder to discuss. Homelessness. What do you guys think when you're driving down the street or see the news or walking by, or what do you guys think when you see homeless people, homeless encampments?
What happened?
It's hard. But we as nurses have to be able to check our attitudes at the door, right? I mean, the staff, we have a huge homeless population here in Denver, and they're located in one section of town. And every time I go to Kaiser, I have to drive by it. And you see the workers out there on the streets trying to work with these homeless people, families, and they're just guardian angels, really are. So homelessness is tough. Homelessness is increasing significantly. Have you all noticed that? And the largest group that is becoming homeless now are families. I just finished 20 years as working in the schools. Just retired last year. Big, huge district out here in Colorado, 90,000 kids. Okay, the last couple of years, we were just kind of COVID nurses. That's just the way it went. But lots of new homeless families. Okay. So homelessness is a big problem in our country right now, right? And we know that it affects men, women, children of all ages, races, ethnicities, right? On any given night, more than 610,000 people, they estimate, are homeless. And more than a third of that are families. Yeah, we know that homeless people are much more likely to become ill, much more likely to have a greater impact on hospitalizations because they don't seek out care, right? They're much more likely to die at a younger age than the general population. And this is pretty amazing. The average lifespan for a homeless person is between 42 and 52. And homeless kids are so much more at risk, whether they're with their family or runaways or living on the streets on their own. They're much more at risk to be sicker, have academic issues at school, developmental issues, behavioral problems, right? And they just don't have the income to be able to find housing. Okay, that's one of the biggest issues for homelessness. Most people don't want to be homeless. Okay, the great majority of people do not want to be homeless. And everybody has their own story of how they got there. Okay, psychiatric illness, obviously, is a big issue in the homeless population. Advanced medical problems for the same reason we just talked about with rural and migrant. They don't seek out primary care. They don't have any insurance. They don't have any money. Okay, definitely exacerbated alcohol and drug abuse. Okay. So how do you work with the homeless? Well, multidisciplinary team approach. Okay. Outreach. How do we get these families, these kids, how do we get them back on their feet again? Okay, what local resources, what state resources do we have? Okay. Homeless people can live on the streets, but they also can live in shelters, missions, single room occupancy places, and even a family who lives with, say, their sister or brother or relative, they're kind of moving around, they're considered homeless. Okay, maybe somebody in the family's been released from the hospital, they've been released from the corrections side of things, and they just don't have a stable housing situation, living with family. That's considered homeless. Okay, here's some more demographics that you can read about. Risk factors. And again, even though I'm skipping over it, doesn't mean you're not responsible for the information. Okay, there's just a lot of information to cover here. Okay. We know that the association, they have one or more chronic illnesses with substance abuse or mental illness, right? Which contributes to early death. We know that in the homeless population, homeless people are 6 times more likely to get sick, 4 times more likely to be in the hospital. Okay. They typically don't have jobs. Okay. And the barrier to getting a job, it just perpetuates the cycle of homelessness. And then very much at risk of the kids, right? Homelessness has extreme negative impacts on kids. Infants born into homelessness have low birth weights. And they're 9 times, incredible, 9 times more likely to die within the first 12 months. Homeless kids are 4 times more likely to have childhood diseases, asthma, iron deficiency, lead poisoning, respiratory infections, behavioral problems. Much more likely to exhibit delayed development, maybe slowed growth and development, and development of learning disabilities. Kids are really at risk. They experience hunger, abuse, neglect, maybe separation from the family. Who knows? And then here's our initial approach. So I want you guys to read through that. How do we approach working with a homeless person, family? Okay, they don't want to be there. Okay. The goal is to establish trust in an empathetic, non-judgmental way. Okay, before we can start to identify their medical issues. Right, we've got to establish trust. Okay, respect, non-threatening, non-judgmental. After hopefully establishing that, then you can start to focus on what are the issues. What are the issues with the adults in the family, the kids with the family, in the family, what do they need? Okay, here's some more prevalent clinical medical conditions of the homeless. You can read through this: cardiovascular disease, dual diagnosis, substance abuse, mental illness, cognitive disorders and TBIs, injuries and violence, STDs. Okay, and on. Skin and foot problems, heat, exposure-related conditions, whether it's heat or cold. They're living out in the streets and it's the middle of winter. Okay. And then here's the model for provision of care. We talked about this integrated multidisciplinary approach with hopefully people that have experience in working with the homeless population. Okay. Can we establish trust enough so that a mom brings her 3 kids to the nearest clinic and we get her a ride to get kids checked out? Okay. Here's a lot of resources for homeless. In your vulnerable population assignment due in week 10 that I touched upon, a lot of students, that assignment is picking a vulnerable population in your own zip code. It's not what's the homeless statistics in the United States, what's teen pregnancy in the United States. It's what is a vulnerable population you're interested in knowing more about in your own community. A lot of students pick homelessness. If you go through that paper, it's really a research paper presented in 10 PowerPoints. Okay, here's a really good visual of resources for homeless. Okay, and then let's cover poverty. Lots of really good resources in this sheet. And then let's cover poverty because it goes hand in hand. Review the following website. So it's asking you, part of your assignment is to review the Healthy People 2030 with regards to economic stability, and gives you a link to it. Okay, so read through these 4 pages. This is your reading for the week. Okay. According to the most, well, going back to 19, but poverty rate was 15.4%. Okay, and that's in the rural areas compared to 11.9% in metro areas. So these first couple of paragraphs are all about statistics. Okay, you don't have to memorize them, but know that the poverty level, the rates of poverty increasing drastically. Okay, and there's some good visuals in here. Poverty percentage, metro versus non-metro. What's the geography of poverty? It tends to be clustered in certain regions. Okay, certain counties, certain neighborhoods, rather than being spread all across the nation. Okay. Okay, so concentrated poverty contributes to poor housing. Poverty contributes to everything. Okay, poor housing, poor health, maybe higher crime rates, employment, unemployment, education issues, access to healthcare. Okay, as a result, poverty in very poor areas can create limited opportunities for poor residents. And this becomes self-perpetuating. It becomes generational poverty. You've all heard that term. Okay. Oops. Okay, we know that there's a higher incidence of poverty concentrated in the South, right? Most severe poverty areas are found in poor areas in the Southeast, Mississippi Delta, Appalachia, and Native American lands. Okay. So these are the demographics. You can have a read through that. Okay, areas with high incidence of poverty often reflect the low income of their racial ethnic minorities. Okay, non-metro, so talking rural, non-metro, Black, African Americans had the highest incidence of poverty in 2019. This is 3 years ago, at 30%. I should look up what the current rate is, but 3 years ago was 30%. That's high. It's extremely high. How is poverty defined? Goes through this of what you have to make to be considered below the poverty line. But a lot of families live below the poverty. I put a lump in 3 groups, and I consider them all one. Below the poverty line, right at the poverty line, and slightly above the poverty line. To me, that's poverty. All 3. That's just my opinion. Okay. Let's go back and review our notes and see what we didn't cover. Okay. So again, am I in your week 3 notes? So before the pandemic, how interestingly is this statistic? Before the pandemic, living in poverty was its lowest, people living in poverty was at its lowest rate since 59 at 10.5%. And during the pandemic, it climbed to 17.3. Okay, more than 48 additional million Americans. Okay, and I saw this firsthand in my school nurse job. I saw it firsthand, families going from having a house to not having a house, going from 2 incomes or 1 income to no income. People lost their jobs. Parents had to stay home, right? With the younger kids. There was no daycare. There was no childcare. You had to stay home and while the kids were remote. Okay, and there's your poverty figures. 24, family of 4 making 24.3 is at the poverty line. What does poverty mean? What's the definition of it? Insufficient resources to meet your family needs. What primary needs are we talking about? We're not talking, you know, like going to concerts and going on vacation. We're talking primary basic needs: food, shelter, transportation, and healthcare. Basic needs. What contributes to poverty? We talked about this a bit. Unemployment, loss of retirement benefits, when a company closes or files for bankruptcy. Maybe weak enforcement of child support statutes, outsourcing of jobs. And poverty, what does it lead to? This is important here. We need to know this. We need to know this right here. Poverty leads to chronic stress, mental health issues, chronic illnesses, higher infant morbidity, mortality, shorter life expectancy, more complex health problems, more disabilities, higher rates of hospitalization. Okay, women of childbearing age are at risk for pregnancy complications. Maybe they don't have consistent prenatal care. Especially think about the teen pregnancy clients. Okay, and then back to young kids are at the highest risk. That's an important statistic. Okay, if you're asked a question of who is the highest risk, what population group in the community is at the highest risk for living in poverty? It's young kids, right here. Young kids are the highest risk for the effects on poverty. It affects the nutrition, poor brain development, exposure to environmental issues, trauma, abuse, and just an overall lower level of quality of care. All right, kids are more likely to have chronic diseases, nutritional deficiencies, growth and development issues, developmental delays. And a lot of times these kids are stuck in the poverty cycle themselves and have decreased opportunities for education. That's the kids. And the teenagers are more likely to have below average academic skills and are 3 times more likely to drop out of school. Higher rates of teen pregnancy. Okay, so then homelessness. Talked about this. We talked about that. Domestic violence. Some women leave violent relationships without the support they need to stay off the streets. And they're often doing that with kids. And here's where I expanded the definition of homelessness. Include those on the street, but also those staying with friends or relatives. Staying in temporary shelters, staying in institutions temporarily with nowhere to discharge to. Okay. and this is really important, as nurses, okay? This is really important. As nurses, it's vital that we respect the individuality of every person. Okay, many factors can contribute to homelessness, and many of us are only 2 paychecks away from being unable to maintain our own housing. Right? It's easy to stereotype, but we will often be wrong in the process. And if we're judgmental, we're probably going to increase the risk of destroying any chance of any kind of a trusting relationship. You can't make assumptions. Okay. This is for families in poverty, homeless families. We want them to tell their stories. How'd they get there? Okay. So, Kevin, here's some examples of primary, secondary, and tertiary. Okay, so this is kind of all over the place. It's giving examples for all the 4 topics we've covered today. Okay, so in primary, teach ways to avoid pesticide exposure, right? Prevent it before it happens, right? Advocate for child immunizations, educate on immunizations being the best form of prevention for childhood illnesses, right? Maybe you're advocating for better living conditions for rural migrant workers to prevent an outbreak of TB or infectious disease. Okay, secondary, what kinds of things will we do in secondary for these populations? Well, we're screening, right? We're screening for evidence of financial, it's all about early identification. Who's at risk? That's what we want to know in secondary. Who's at risk? We're screening for risk. Okay, so in secondary, screening for evidence of financial instability, right? Especially those with chronic health conditions. We're educating about the importance of yearly blood pressure checks, yearly, A1C checks and BMIs. A1C is related to type 1 diabetes. Elevated A1Cs are a problem, right? We're educating on the importance of scheduling screenings, cancer, colonoscopies, pap smears, colonoscopies, mammography. And then what does tertiary mean? You know that P is prevention. Primary, P is prevention. Secondary is S, screening, right? And tertiary, to keep it consistent, I call it testing. Treatment, no, I'm sorry, treatment. Tertiary is treatment, right? They already have something, right? They already have a chronic disease or an ailment or an illness or something. So now we're helping to treat it, to manage it. Okay, maybe helping a homeless client find and apply for resources. Why is that tertiary? They're already homeless. Referring somebody to the health department for treatment of STDs. Why is that tertiary? They already have STDs. Teaching a client how to take their medication. Why are we doing that? Because they already have they must have a condition that requires them to take medication. Right, so remember, tertiary is treatment. We're helping them manage whatever they have. Okay. Questions? So just for information purposes, the study guide is a summary of those 3 weeks of notes. I've pulled out what I think are the important concepts and topics that you may be asked about on the exam. Okay. And I've added some additional information. Not a lot, but there's some additional information on the study guide. Okay, I'll update the notes for next term, but I want to make sure it got on the study guide. So not new topics, but just additional information within the topics we'll cover. Does anybody have any questions? Has this been helpful to do it this way?
Yes. But I have a question. The quizzes, it seems like it's better to take the quiz after class on Friday since
That's the goal. Yeah.
typically covering that week's material, correct?
Correct.
Okay, thank you.
And if anybody has submitted their quiz, I haven't looked to see if I can reset it yet for you to take it again. If I can, I'm perfectly fine with that. Like Sarah. No, I'm not gonna, I don't want to bring up your page, but I know I can do it with NCLEX. So if anybody wants to retake the quiz, shoot me an email and I'll see if I can reset it. It's easy to reset it for NCLEX, but I'll see if I can reset it for you as well. Because I think you're only supposed to take it. You know, the other difference that I worked with the curriculum team with this week is, I think it's question 4. It's like a select all that apply. It was giving you guys partial credit if you got 1 answer or 2 answers. We eliminated that. It's either all or none. Because I had to keep going back into the grade book. Say you got an 8.33 or an 8.66. It needs to be a whole number. So I went back and we redid the settings. So now I think it's question 4. And that may be on exam 1. I don't know. But there's, of the select all that applies that you have, it's all or none. So that will make it a little bit easier. And then, oh, I know what I wanted to do. I did it with my other classes this week. Do you guys want to review quiz 1? It's up to you. A lot of
Can we review quiz 2, number 2?
No, I'm not reviewing quiz 2 yet because you guys need to take it and see how you do. We'll review that next in week 5.
Oh,
Okay, after the exam.
okay.
But if you want to review quiz 1, I'm happy to do that. The one thing that I find a little bizarre, oh my gosh, what am I doing here? The one thing that I find a little bizarre is that when you submit the quiz, you can only see your score. You can't see what you got wrong. And so I'm trying to figure out how to maybe change that. I'm not sure I can, but in the meantime, you should know what you answered on your quizzes. So when we go through it real quick, you can say, oh, I got that one wrong, or does that make sense?
Yeah. Hey, Miss Marvel.
Yeah.
Do you communicate through Canvas? Because I don't have access to my school email. Long story, but I don't have access to my school email, and I would like to see if you could reset my quiz for me. So do you communicate through Canvas at all?
Yeah.
Okay.
I have access to Dr. Kershaw's classes. So
Okay,
I
so
can
just text it through there to Kershaw, and you will get it.
reset. I'll send you an email if I'm able. I'll send you an email either way, whether I can reset the quiz or not.
Okay.
Either way.
Thank you.
Yep. Oh my
I
gosh.
don't know. Quiz. I thought it was on the week prior, so I had reviewed week 1 and not week 2, and I didn't do as good on week
Okay.
2.
So just
That's
send me
how
an
I
email,
found-
Sarah. Send me an email, Sarah, to reset your quiz if you want. Sarah, what's your last name?
But
Can you spell that for me?
yes, as TIB as in boy, TIBBETT. So there's 2 B's and 2 T's at the end.
Got it. Okay, I'll try and reset you guys. Let's go over the quiz real quick. This has been helpful to my other groups this week to review it. Okay, so this is interactive. Everybody can chime in. Which is an example of community-based nursing? What'd you guys put? Remember, community-based, you're based in the community, so you're
Are you
working.
sharing your screen?
Oh, sorry. Nope, I'm not. You guys are so smart. I'm not. There we go. Sorry about that. Okay. What's community-based nursing? You're based in the community, taking care of populations. So what would be the right answer?
The educating child with an inhaler.
Yep, that's
Yeah.
exactly right. You're working in the community, you're working in the schools, teaching a kid how to use an inhaler. The other 3 are all community-oriented nursing. right? Outcomes, you're looking at outcomes of the community vaccination program. You're developing a teen pregnancy program. That's community-based, right? So educating a child on school teacher on the use of inhaler. You're in the community working as a school nurse. Question 2, which describes the purpose of Healthy People 2030 campaign. You were asked to peruse that website in week 1. What's their motto?
Or
It's D,
Yep. Why, Devon, is it D?
because it says that it improves the health of all Americans.
All Americans. Okay. Healthy People 2030 is geared towards all Americans, as was 2020. Okay. Number 3, which is true regarding uninsured and underinsured individuals.
Here,
Just
let's,
talk- Go ahead.
C,
Why is it C? We just talked about this today.
because since they're underinsured, they might not be able to catch the disease in its beginning stages.
Exactly. Great job. Excellent. Excellent. That's exactly right. Okay. So yeah, this is the question number 4 that which are the correct answers? You either need to get all of them right or to get full credit. So who is a vulnerable population here?
HIV, the war
Yep.
veteran, and the substance abuser.
What's the other one? HIV, substance abuse, and which one?
War veteran.
Absolutely. Absolutely. Those are your 3 right answers. So B, D, and E. Why isn't A the correct answer?
I mean, just because they're pregnant, I mean they're vulnerable.
Absolutely. Which is the vulnerable population with regards to pregnancy?
The baby itself. What you
Teen pregnancies,
teen pregnancy. Yeah.
right? That's considered a vulnerable population, but not a typical 26-year-old pregnant woman. So be careful with that. All pregnancies, like Kevin said, are not considered vulnerable, but adolescent ones are. Okay. Which statement reflects the term resiliency as it relates to vulnerability? What does resiliency mean? Let's start with that in terms of vulnerability. You're going to work real hard, right, to improve on your vulnerability, right? That's resiliency. So what's the right answer?
Resiliency reduces our vulnerability
Yep.
to certain risks.
Yep, perfect. And why is that?
Oh, I don't know.
Because you're working real hard at your current vulnerabilities, trying to reduce your risk. That's what resiliency is all about, right? Okay, number 6. This is a priority question. When you think of priority questions, what are we thinking first? What do we think with priority questions? ABCs. What's ABCs?
Airway, breathing, and circulation.
Okay. Yep. So now answer the question.
Is it the last one?
It's the
Yep.
9-year-old.
Yep.
I
Why?
got that wrong because she told us children. I mean, I knew better, but she told us children that doing over exercise. That's why I didn't pick it. That's why I chose the itching child.
Well, let's think about it. The itching child can be dealt with. So can the complaining of burning and excessive tears. So can the inability or mismedication. A, B, and C can all be dealt with in time. Or, yes, but D has to be dealt with right away. And that's what it's asking. The question is, who should she see first? So you have to prioritize. What is complaining of a cough and unable to participate in physical exercise. What is that?
Asthma.
Asthma attack,
Yeah,
Those are
asthma.
right?
Right, but she
Heroin.
told us it had if it something about excessive exercising that would be the issue. Don't let it trick you. And I didn't pick it because of that statement she made.
Okay.
And I got it wrong.
Do you understand why D is the right answer now?
I understood it was the right answer from the beginning.
Okay. I'm not sure how Dr. Kershaw presented the issue to you. But what I want you to take away from this question, you already knew the right answer to everybody, is it's a priority question. Okay, we can deal with A, B, and C later, but we got to deal with this 9-year-old who's probably having an impending asthma attack. Okay, number 7. Which food do we want with iron deficiency anemia?
Eggs.
Nope. This was in your notes from last week. What is iron deficiency anemia? What do they need?
They need iron.
Did anybody get this right? Anybody pick eggs?
That's what I said.
Oh, did you say that? I didn't hear you. Sorry. Why? Sorry about that.
Because it has iron in it.
Protein, iron. Yep. Okay, good. So eggs is the correct answer. Number 8. School nurse notes a dark discoloration along the neck crease in the armpits of a child. Which step should the nurse take?
Advise parents.
Yep. Why? What could this be a symptom of?
I forgot the name of it. The hard
Diabetes.
Diabetes.
I thought it was the other thing. Where Black children, I think Hispanic children get it. What's the name of that?
Magnolia spots? Is that
What you say?
Are you talking about magnolia spots?
Not
Oh.
those. Those for babies. I'm talking about Marisol Nigerian.
Oh, ankythrosis. That's what this is. That's what this it's a dark discoloration. We're just describing it for you, but it is that. And if you look in your notes, what is that a symptom of? It's a symptom of, possible symptom of diabetes.
Oh, so all of it goes together.
Yeah.
Oh, my bad.
No, that's why we're going through it.
Okay.
Which nursing intervention is a priority for a child experiencing a developmental delay? What have we been talking about? What did we talk about last week? Is one of the symptoms of what could a child be experiencing developmental delay? Look in these 4 answers. What have we covered?
Lead exposure.
Is this the
Exactly.
last one? The lead.
Lead exposure. That's in your notes from last week. It's on your study guide. And then the last question is, the nurse notes that a BMI is in the 90th percentile. That can't be good. Which intervention is appropriate?
Less TV time. Is it less TV time?
Less screen time. Yep.
Yeah, that.
Less screen time. Why? Less screen time means a more ability to exercise. Right. Of course, we don't want them to stack more during the day. And of course, 100% fruit juice is a no-go, right? Empty calories, sugar, right? I don't think they need an urgent medical evaluation, but we need to try and encourage parents to reduce screen time to increase exercise. Try to get them moving. So is that helpful to go over? It's a review of week 2, right? So the review I'm going to do here in a few minutes is the study guide. I'm going to review the study guide. But remember, when studying for the exam, you've got 3 weeks of notes and the study guide, which are all going to look together. They're all connected. The 3 weeks of notes is not new information that's on the study guide. I've pulled it from there. And then when you go back and do your readings, if you haven't, the content in the readings is in your notes, which is in your study guide, right? So everything's connected. It's not 3 areas of new information. You got to do your reading, you got to do your notes, you got to do your study guide. All those 3 have the same information. Okay. So if you know your study guide, you'll be fine for the exam. Okay. Everybody pull up their week 3 attestation. Because I like to do it at the end so you don't forget about it, because it's supposed to be done within 24 hours of class and people forget. And I had to send a whole bunch of emails this morning, do your attestation for my Monday, Tuesday, and Wednesday classes. So I teach 1 class in the RN program and 3 PN classes. And I'm covering for Dr. Kershaw, and she's got 2. So kind of busy. But I love it. I love it. So all you have to do for attestation is Professor Marvel, what's the date today? I don't even know. Say the 29th?
29th.
Okay, so Marvel 29. And then submit it, check it off your to-do list. So what do you have to do? What's left for this week? Do your quiz over the weekend. Try and get to a review session today or tomorrow. If not, watch the recording. Okay. Really, really hone in on your study guide. If there's things on your study guide you don't understand, go back to your notes, go back to the book. But you are responsible for, I mean, the study guide, I did the best I could. Okay. Everything's not in there. So go back to the nice thing about this updated curriculum with this class is you've got very specific reading. I mean, look at all the childhood ailments. You gave you page numbers in your book. Okay, so I think it's laid out very, very nicely. Okay, what do I got going in the chat here? Everybody make sure they put their name in. Okay, what do we got going? Chat. Oh, these are all your. Everybody got my email and my phone number? I'm going to send you your HESI prep study guide. I wouldn't worry about that this weekend. Let's just study for the exam. Okay. And study, I mean, this isn't, 20 hours, just if you're keeping up, that's the other thing with this class. It's not a hard class. Just keep up, get your stuff done early and go off to your other classes. Okay. Well, I've really enjoyed meeting you guys. I hope this has been helpful. I'll see you next Friday for the exam. I'm going to start posting in your announcements, obviously. So I'll put my contact information in there as well. Does anybody have any questions? Everybody submit their attestation, so you have to worry about it. I'm giving you 13 minutes to get off early. Go do your quiz. Jump in there now and do your quiz.
But
Okay.
after next week, since we have class right afterwards and we're probably going to have our other exam, if we're done with the exam, may we be excused for the day?
Yeah, I don't, yes,
That will help.
absolutely. And I'm going to send out a recording for
Okay.
week 4 content. So
Thank you.
we're not coming back.
Thank you.
You're welcome. All right, I'm going to stop recording here.